I've done pediatrics. I've worked in the nursing home. I do an assisted living, PRN.
Okay.
So, I mean, I've worked in a lot of areas. The only one that wasn't my passion was home health. I did not enjoy it. Now, is it the most functional OT? Yes. Because you go into someone's house. I mean, as an OT, we are getting them back to taking care of themselves.
Okay.
We're getting them back to,
you're in
their setting.
Right.
So you're able to see them function and see what difficulties they experience in their own setting, and to, see them live their life in their, it's a lot different
than being in
the hospital
or in a clinic.
Yes, exactly. Having to, walk to a bathroom that's in a very well lit, uncluttered, hospital room versus being in their home setting where there's
that makes sense.
Everything that's an obstacle, basically.
That does make sense.
Yes. So home health is probably the most functional. Was it my favorite? No. And a lot of that is probably due to I had trouble with a lot of the maybe lower income families and the struggles that I had to walk into, and it just broke my heart. It totally broke my heart. So I had troubles.
Yeah. And then, okay, so what is a typical day like for you?
For me now, I
know you're busy.
I know, well, busy with my family, but as far as work, I work at Valley View 2 days a week and Brooklyn 2 days a week. So I do school setting only. So I'm only there from 8 till 3.
Okay.
I see one kid an hour, and we typically go hour to hour. I mean, we'll have one kid every single hour.
Okay.
So typically I'll have anywhere from 6 to 7 kids a day, depending on if they're, absent or at school. We pretty much treat all of our kids for 1 hour. So I get to the schools by 8, and, then I start treatment. Yes, and the majority of, my kids, a lot of times, have fine motor delays, some sensory issues that we have to address. I have a few that are behavioral that we go through, some that are just strengthening core versus, extremity weakness that we have to, tackle. And so.
Okay. So do you work with all age groups there?
I do. I see, I have a preschooler, and then I have a senior this year. Okay. So, I mean, it just, different. I see the entire spectrum at schools. So.
And how often do you see each kid?
It varies, but most of them are either twice a week.
Okay.
And then some of them are once a week.
And is that the only occupational therapy treatment that they get, or do others? How exactly?
Most of the time, there is the exception where there could be a child that's more severely affected, and they can get a certain amount of hours within the school setting, and then some of them on days opposite of what they get in school, they'll go to an outpatient clinic after school services.
Okay.
So
awesome.
The clinic, you're able to do probably a little bit more focus on sensory issues. It just, because of, we just have more available within the clinic setting versus what we can do in the school setting.
And do you still work in the clinic setting during the summers?
I do.
Okay.
I do. And I do fewer hours.
Okay.
But
hours.
Yes.
And how do you see those kids twice?
It's once to twice.
Okay.
It just kind of depends on a lot of times what we do with Playtime is we'll do our testing based on their scores. That's where I justify whether if it's once or twice a week. Most of the time we always, like I said, do the 60 minutes, and most of that is because anything below that, to me, and this is purely me, there's some transitioning. There's a lot of up and down time as far as trying to get the kid, sat down and, focused on doing, your job. Well, if you only had 30 minutes with them,
you're spending half of that.
You are. And so I feel like I'm able to better, serve my kids with a 60-minute session.
So do you choose on your own the amount of time?
Yes.
Okay.
As the OT, you can choose, you look at the scores of their tests, and based on your recommendation is what you can, recommend for them. Now, the doctors then initially sign off on a script, and then they have to sign off on our eval. So they have the final say. And so does, within the school setting, it's based on each building that you go to.
Okay.
What they allow you to do. I mean, some schools are fine with you pulling them for 60-minute blocks. There's other schools that probably would not like them being pulled out of gen ed for
Okay.
that 60-minute time.
So do you see kids that are in normal everyday classes?
I do.
Or
I
and
have-
then ones that are in the special needs
I
classes
do.
as well?
I do. I see most of my special ed kids, they're a lot easier to pull. When I have we have very good teachers at both the schools that I go to that have been well educated in what OT does. And if they notice fine motor delays, or if they have trouble with handwriting, or even just sensory sitting still in class, or acting out, they are very good at referring to us. So if we get a gen ed student, we work very closely with the teacher to make sure that we find an area that we can pull them that will not be detrimental to their.
Okay. I didn't know that you worked
Yeah.
with
Oh yes.
kids like that.
Mhm.
Okay, awesome.
Yeah.
And then my last question, which you kind of answered, but do you feel like this job is rewarding, and if so, why?
Very,
and how?
very. Just like I said before, just that just knowing that you make a difference in someone's life. You have your struggles too. I've held a person's hand while they passed away.
Right.
I've had the patient come back in to see me that chronically has dislocated their hip that they had surgery on. I've had, so you see your struggles. I've had the stroke patient that, you had such high hopes that they were going to regain movement, and 6 months later they still have nothing. So, I mean, you have your struggles with that. And you, as the OT, because we do self-care, we get so very close with our patients. I mean, we learn the ins and outs of their lives. So when they fail, I fail. I mean, it hurts. It truly hurts. And so, but then the rewarding part is when they do, experience and they, make those hurdles and they achieve their goals. It's just so exciting to see what they can do. And then to come back 2 years later and see a patient that still is so, just when they see you, they just light up because they're like, look what I can do. And, I mean, they're like, I can
awesome.
walk, I can get dressed. I can, they weren't able to button a button on their shirt, but they're like, I totally dressed myself today. So I saw one of Teddy's patients actually this week, and we stopped and we were talking, and he goes, look, and he did his shoulder, and he was like, my arm's like 100%, and it hadn't been in, I mean, it wasn't all through high school, and Teddy saw me when I was 28,
That's awesome.
Yeah, so I mean, you get that kind of feeling from it, and so I
Well,
love
thank
it.
you. I
love
guess
it. You're
we're done
welcome.
with that.